Hi, my name is Dr. Ron Peek. I'm a chiropractor in Mount Laurel, New Jersey. I'm also the creator and developer of a series of self-help videos that we use in our office with our patients, allowing them to subsidize the care that we provide. And what I'm going to show you today is the content of one of those videos. We're going to show you how to stretch the muscles in your neck. Having tight neck muscles is very common in our society nowadays. We use computers extensively and we're craning our necks looking forward. We're dealing with a little more stress in our lives right now. So consequently, tight neck muscles are common, and tight neck muscles can cause lots of problems. They can cause headaches. They can cause pain in the neck, obviously. They cause restricted motion, limited range of motion. Also, tight neck muscles basically can cause the joints in the neck to become inflamed and lead to arthritis, and ultimately they can cause the disc to start to deteriorate because there's not as much movement and lubrication going into the disc. Significant problem, and yet something that can be dealt with. I want to show you four very simple, very common exercises. You've probably seen them before, but I'm going to demonstrate these four exercises, and I'm actually going to show you several secrets. Oh, secrets. So watch carefully, and hopefully you'll learn some things that will allow you to maximize some very simple exercises. The first exercises we're going to do are rotations. In other words, we're going to look to the right and look to the left. Now, before I show you the rotations, because I'll be talking to the side and you may not hear me well, let me explain what you'll be watching. First, I'm going to turn my head to the right as far as I can. Then I'm going to wait for a second and actually turn my head just a little further. Now, you may say, well, if you went as far as you could the first time, how can you go further? And the answer is, that's one of the secrets, because when you turn your head as far as you can initially, lots of times people think that's their stretch. But if you just give yourself another second, there's going to be a release of something called joint play, and you get just a little bit more movement, which means you can go further. And then secondly, a second secret is, I'm going to use my fingers and just put them on my cheekbone and push a little further and accentuate the stretch that way. Now, I have to make a point here. There's an old concept about no pain, no gain. We're not into that on this video. We don't want you to be in pain. As a matter of fact, if you're extremely uncomfortable doing a stretch, you're not doing it properly. So all you need to do with the stretch is feel the stretch in the tissue. And we're trying to maximize the stretch but not cause any discomfort. So please don't think you need to be in any discomfort when you do this. Now let me demonstrate what I just said. And you may not hear me as well when I turn my voice. So I'm going to turn to the right. I'm going to wait just for a second, let the tissue relax, and go actually a little further. Now I'm going to put my hand on my cheekbone and push further. Now there's my stretch. I'm not in any pain. I would hold that for 20 seconds. We don't need to do that right now. And then I would do the same thing to the left. Again, turn my head, wait for a second, joint plays out, push a little further, etc. Now, very simply, you can get much more benefit from your stretches when they're done properly like that. One more point about that. If you find when you're turning to the right or to the left that you turn more easily to one side than the other, let's say I'm tighter when I go to my right than I am when I go to my left, then what you do is 2-to-1 ratio. In other words, do the tight side first, the non-tight side once, and go back and do the tight side again. You can even do a 3-to-1 if you really need to. But you'll find if you even things out like this, you're going to balance yourself much more easily. And by the way, that's the third secret in this video. All right? So you're learning an awful lot today, aren't you? Now that stretches for the neck in rotations. The other type of stretch is called a side bend. And a side bend means you're going to try to touch your ear to your shoulder. Now you're not going to cheat and raise your shoulder. You're just touching your ear, or actually you're moving your ear towards your shoulder. And the most common error in this stretch is people try to touch their chin to the shoulder, and they do like that. Don't do that on a side bend. On a side bend, it's strictly ear to shoulder. And it's the same principle. You go as far as you can, you wait just for a second, get that joint play out. Now you have to reach up, and with your fingertips, pull a little further. I'm trying to stretch to this side. And I'm going to hold that for 20 seconds, etc. And then I'm going to do the same thing to the other side. Go as far as I can, get the joint play out, etc. You got the idea. So those are four very simple stretches to do. Now the reason you hold a stretch for about 20 seconds, and it's not a magic number, is it allows the tissue to relax more effectively. So give yourself 20 seconds. You don't need to get too carried away there. Now, if you have any difficulties like neck problems or headaches and things of that nature, give these stretches a try and see if they don't help you out. I think you'll be pleasantly surprised. Now I have to put in a disclaimer here. Please see your doctor and get his or her permission or approval before you do these stretches on your own. If you're not under my supervision in my office, obviously, we want you to be as careful as possible. So check with your own doctor before you do these stretches, just for your own benefit. Better to err on the side of safety. Now last but not least, if you are having some difficulties with your neck, headaches, shoulder problems, things of that nature, and you'd like a professional evaluation or opinion, you can call our office, 856-778-8653. Mention you've seen this video, and we'll provide a no-charge free consultation and examination with you to see if there's something we can do from a chiropractic standpoint to help you out. If we can help you, we'll let you know, and if there's nothing we feel we can do for you, we'll tell you that also. Well, I hope you've enjoyed this and found it informative and educational. I enjoyed doing it, and I'll see you again on my next video. Thank you.